Hi everyone, welcome back to my YouTube channel, and today we are going to talk about embolism. So let's start our topic with introduction. Embolism is a pathological condition in which an embolus travels through the bloodstream and lodges in a vessel, causing obstruction of blood vessel. Embolus is a detached intravascular mass. It is a major cause of morbidity and mortality worldwide. Definition of embolism. An embolism is defined as the occlusion of blood vessel by material that may be solid, liquid or gas that has been carried in circulation from a distant site. Types of embolism. First type is thromboembolism, that is caused by fragments of blood clots. Second type is fat embolism, that is by fat globules that enter circulation, often after fractures of long bones. Third type is air embolism, that is air bubble in blood vessel that are seen in trauma or surgical procedures. Fourth type is amniotic fluid embolism, that is rare but serious complications of pregnancy. Fifth type is septic embolism, that are emboli that contain infectious materials. Sixth type is tumor embolism, that is spread of malignant cells through blood vessels. Causes of embolism. First cause is trauma and fractures. Second cause is surgical procedures. Third cause is deep vein thrombosis. Fourth cause is heart diseases like atrial fibrillation and myocardial infarctions. And fifth cause is obstetric complications. And sixth is infections and malignancies. Pathogenesis of embolism. Embolus travel through the bloodstream until it reaches a vessel that is too small to pass through. This leads to obstruction, ischemia, and tissue necrosis. The severity depends on size, type, and location of embolus. Common sites of embolism. First is pulmonary embolism, that is embolus that lodges in pulmonary arteries, thus impairing oxygen exchange. Second type is systemic embolism, that is embolus that travel through arterial circulation, affecting organs like brains, kidneys, or spleen. Third type is cerebral embolism that causes ischemic stroke. Clinical features of embolism. First, there is sudden shortness of breath like in pulmonary embolism. Second, there is chest pain and cough. Third, there is neurological deficits like stroke. And fourth, there is limb pain, pallor and coldness like atrial embolism. And fifth, there is shock and collapse in severe cases. Diagnosis of embolism. It is diagnosed first by imaging that includes CT pulmonary angiography, or Doppler ultrasound, or MRI. It can also be diagnosed by blood tests that includes D-dimer level. Third diagnostic strategy is echocardiography for cardiac sources. And fourth is clinical examination and history. Complication of embolism. First, it can cause pulmonary hypertension. It can cause stroke and permanent neurological damage. It can cause organ infarction like in kidney and spleen. And it can cause sudden death in massive embolism. Management of embolism. First we do is medical treatment that include anticoagulants like heparin and warfarin and thrombolytic therapy. Second, we can do is surgical intervention, that is embolectomy in severe cases, that is basically removal of embolus. Third strategy is supportive care that includes oxygen therapy and IV fluids. Fourth, management include preventive measures, that is to wear compression stocking, to take prophylactic anticoagulation in high-risk patients. Prevention of embolism. It is prevented by early mobilization for surgery. It can be prevented by adequate hydration, by avoidance of prolonged immobility, and by control of risk factors like smoking, obesity, and heart disease. Conclusion of this lecture video. Embolism is a critical medical condition that can lead to life-threatening complications. Early recognition, prompt diagnosis, and effective management are essential to reduce mortality and improve patient outcomes. And this was all about embolism. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.